Hey everyone, back again for another lecture. Today we're going to be talking about the human skeleton. This is a very kind of brief overview of a few topics. In the 110 lab, if you take it with me or if you take it with any of the other instructors, you are going to be able to get a more solid introduction. It's still introductory level, but you're going to be able to dive into the content at a much different level than the lecture. In fact, I think I'm only one of a couple of the lecturers for the 102 who even kind of talks about osteology. Usually we just kind of save that for the lab course, but a handful of us teach both, so I feel like it's good to at least get you guys introduced to some of it, because what ends up happening is if you have at least a little bit of a handful of the terms or names of some of the bones just in your mind, when you go into the lab, it's not 100% new information, because that is definitely the hardest section to learn in that class, as most students will probably say, because you're doing a lot of like rote memorization. So for this, even in the lecture course, if I introduced a handful of the terms, you know the names of a few bones, you kind of get that introduction to it. So we'll just go through this PowerPoint. If you've already kind of skimmed it, you'll see a lot of it's just images, because we've got, just names or images and the names of bones. The first few slides kind of give us a little more background. So you'll see like the first slide, like after the title slide. So it's talking about the ways that you can measure the bones, some of the tools that are used. You can see even in the image on the slide, it's got what we call spreading calipers. We also in the lab will sometimes use what are called sliding calipers. Basically, they're these tools you might use to measure parts of typically the skull, right? You can't just use a ruler because, well, one, linear measurements only give you so much info, but on like an item as intricately shaped and complex as like the face, the skull, you have to be able to find different ways of getting some of those more intricate measurements beyond just, like using like a tape measure. There are ways even beyond using the calipers where we can use like, computers and stuff. But in the introductory course, we definitely go over some of those, more simple ways of doing it. Like in the lab, you have just a specimen in front of you using some calipers. There's a lot you can learn about the skeleton when you have even just fragments of it or parts of it or the entire thing. You can definitely determine, and as per these bullet points, you can determine how old someone is. That's much easier when someone's young, especially if you have the teeth. You can get pretty precise with age. You can get within like a few months of how old someone is, because our teeth as humans like erupt at a very particular like intervals and in a particular order, so you can get pretty precise with someone's age. After early 20s, depending on what you have available in terms of remains, sometimes you can have a little more broader categories, so you might be able to determine, okay, this person's probably between 20 and 30, but it all depends on what you have available. If you have like the entire skeleton, you could probably get a little more precise. But once you get, older, let's say 40, definitely like 50 plus, a lot of times the categories are just that. You could say, well, they're between 50 and dead or something. You know what I mean? So when you're young, it's a lot easier to tell. You can also determine sex, so male versus female. The best parts of the skeleton, like when you just have the skeleton, the best parts of the skeleton, should be no surprise, if you have the pelvis, is the number one best way, best, region. And there's like, when you're looking at the pelvis, which we'll do on one of the other PowerPoints, it's not just looking at it in general, but there are multiple, features to that whole region of the body where you can look at them individually and be able to, determine if you're looking at a male versus a female. Let's see, ancestry, stature, or someone's height. That one you can, if you have any of the long bones of the body, so the femur is the best one to have, but any of the bones of the legs, even the bones of the arms, because our arms and legs are kind of in a particular ratio. So you could even have one like this bone here, the humerus, and you could still get someone's height within, plus or minus a couple centimeters, which, let's say all the remains you found were like a humerus, and you're like a forensic anthropologist, and it's like, okay, is this that missing woman who was, 5'8"? And then, you have just that humerus to go off of. You could determine, well, this individual in their lifetime would have been, 6'3", plus or minus, 3 centimeters. You at least know, well, that's not the person we thought we had now. This is someone different, right? So even the smallest amount of information can be really important. And then, of course, health. Not every Not every disease you have will affect the bone, but many affect the bone directly. A lot of diseases affect the bone indirectly. So you could be able to determine, just one individual, or if you have like multiple individuals, like kind of at the population level, what maybe certain diseases were occurring, certain injuries were occurring, all very interesting. Just from having just a lot of sometimes like visual methods, too. The next few slides kind of go over a little bit about the skeletal system. You'll see that, once again, this is, I feel like common knowledge, but the skeletal system is set up to support, basically, it's like the framework of the entire body, and then also protect certain vital areas. So we've got like ribs protecting the lungs and the heart, the pelvis protecting all the reproductive organs. So the skeletal system, along with the muscles, so the musculoskeletal system, is basically like the framework and like the pulley system for movement in your entire body. Also, when we talk about the skeletal system, that also includes the cartilage, not just bone. So that could include the cartilage like on your ribs, between your vertebrae. You have some cartilage like in your face. So all of that is still included in that entire skeletal system. And essentially, when your body is developing, fetally, and then even once you're born, a lot of that is still cartilage, and then it will eventually like turn into bone. But as we'll get into, oh, actually, I think we talked about it already on another lesson. Oh, yeah, I think it was the human variation one, right? Where it's per like the correct nutrients, because if you're really deficient in certain nutrients, that cartilage will eventually turn into bone. But the question is it going to turn into like the correct or close to the correct shape that it's supposed to? Let's see. There are two main sections to the skeletal system. So this is slide 6. We've got the axial and the appendicular. So appendicular is a reference to the appendages, which maybe you've heard that term before. So that's a reference to the arms and the legs. So that's kind of one system. And then the other system, the axial, is kind of like everything in the middle. So that includes like your skull, your like ribs, your sternum, your spine, and then everything on the appendages, arms and legs, that's all part of like the appendicular. And you'll see here, you can kind of separate those, on the appendicular, you can talk about the upper limb, your arms, your forelimbs, or your legs. And then of course you have different sections in any of those areas as well. Let's see. Let's do slide 9. You will see, some of the parts of the body where we can determine age. So one of the best ways is by looking at this particular region of the pelvis. So in the human, and there's an image on this slide, you'll see it too, it's in the top right. When you're looking at like the pelvis, you have a left side and a right side. We call, we don't typically say pelvis. That's fine. It's a general term, but we'd say like the left os coxa or the right os coxa to mean like the general bone. But each side, left and right, actually has 3 separate bones. I'll get to that in a minute. But when you're thinking of like that whole kind of structure of the pelvis, they connect to each other in the front, like the left side and the right side connect to each other in the front, like kind of right in the front, kind of low, in your pelvis, in that region. And they connect, actually, what you'll see in this image is that little red area. So there's just kind of small area. It's probably about like, an inch, a little more than an inch. And that's the region that kind of connects the left and the right together. If you were to kind of separate them at that point and kind of look at where they were connecting, like that surface, which is the second image on here. It's kind of showing you that what it would look like if you kind of separated them and we're looking at just that little tiny area. It's about the size of like a big thumbprint. I would say that's a really good way of thinking about it. So that's the connection point of the left and the right. It's called the pubic symphysis. There are certain features on just that little region of bone you can look at that can really guide you in determining, especially at this level, like if someone's young, like middle-aged or older. And so some of the features would be billowing. Billowing is like, does the bone kind of do this nice wavy, does it have a waviness to it? Is the region, like the rim of the region, is it very clean and really crisp, clear? Or is it like broken down? Does it have chunks missing? Basically, if someone's young, it's going to be nice and billowy with like a really clear edge to it. As someone ages, you're going to see the billowing kind of disappear. You're maybe even going to see some like small pores or large pores. rim or the edge of the feature is going to start breaking down, like things you would kind of associate with like young versus older, like just general deterioration. And when you take I'm assuming most of you will be taking the lab. When you take the lab, you would be able to kind of see those features and say, oh, I can see here's like where it looks kind of smoother, or there's porosity, etc. But just know, like for this class, just know like that's one of the regions that is really useful in determining age. And the same thing goes for the area in the back of the pelvis, where the left and the right connect to the sacrum. So at the base, like you have all your vertebrae, right? And at the very bottom, you have this kind of triangular shaped bone. It's called the sacrum. And then the pelvis on the left and the right kind of connect to that in the back. If you also were to separate them and look at that surface, it's kind of the same thing. The shape is different, but the features you would look for, billowing, porosity, etc. So those are just two really good areas of the body to be able to determine someone's age, or at least be able to narrow it down. Let's see, slide 11, you can see some of the sutures. So the sutures, so when you think of like your skull, you don't have just like one big head bone, right? You have multiple bones that for the top of your head, the side, the back, all of the bones of the face, right? Even internally and stuff, they're all separate bones. It's not just one giant bone. Well, the connection points, whenever two bones connect with each other, that's called a joint. Now, typically when we think of a joint, we think of what's called, it's a very particular type of joint. It's called a synovial joint. And it's like, like a movable joint, like your knee or your elbow. But in reality, whenever one bone articulates or connects with another bone, that's a joint. And there are different types. One of them is called, what we have here, the sutures. Those are immovable joints, so they don't move. You see the connection point often in that kind of like squiggly line. Usually you'll see like either really clearly or a remnant of it. That's like the joint or the connection point. So when you're looking at the skull, you'll see some of these squiggly lines like on the top and the bottom. That's just showing you where those bones are either directly connecting or maybe slightly overlapping and connecting with each other. But you'll see on this image on the slide 11, at the top, it's kind of open. That's showing you someone who is quite young. So when you probably have heard of this. Like if you've ever like held a newborn, they tell you, oh, be careful of the soft spot. That's actually called, hold on, I didn't think I would need this, but now I'm like, where are my wipes? Oh, well, I've lost everything. Where are, oh, well, never mind. I was going to write something down, but it's got last lesson's stuff on it. Well, here, I'll just write around it. I'm like, I had a giant thing of wipes somewhere. Oh, well. So the soft spot, the technical term is called a fontanelle. So ignore the other thing. So fontanelle, ignore that chart. So fontanelle. So that is the technical term for like the soft spot. So it basically, I mean, there's a kind of a whole backstory to it, but essentially there needs to be a little pliability with the skull. It's kind of coming, like it's, her offspring is being born as it kind of goes through this very, very narrow area of the pelvis, And so there has to be a little pliability with how the bones kind of get through. And so that openness kind of allows for that. And this is true for like most of the parts of the body in an infant, which is why their limbs look kind of weird. Their limbs are kind of bendy and stuff. It's because a lot of the skeletal system is still in pieces. Sometimes there's cartilage connecting, sometimes it's not. And it's just kind of like floating in the body. It depends on if you're like, you've only been born a couple days, a couple weeks, a couple months, like all of that will start to fully form. But that's why in the first few months that newborns have like their limbs and stuff look a little strange. It's because everything's still kind of coming together at that point. So the sutures are just, a part of that. It's really bugging me where my wipes went. Everything else is here. I don't know. It's probably right in front of my face somewhere. That's fine. Okay, so then we have a few slides that just kind of show you some of the bones, some of the names of some of the more prominent bones. Some of these you probably have already heard of. I'm assuming like maybe most of you know like the femur or the humerus, but here I've just given you a list of some of the more well-known ones or prominent ones. So when, like I said, when you go into the lab later, you're like, oh, I already know, 10% of that list, or, depending on your instructor, 20% of that list. So you can see here the first bone on slide 13 is the humerus. So this is the bone here, like in the upper part of your forelimb or your arm. You have one bone up here, and then you have two bones on that more what we call the distal portion. It's the same on your legs. You have like in your thigh area, you have one large bone, and then in the bottom part of your leg, you have two. So it's similar on both the arms and the legs. So the humerus is that bone on the upper part of your arm. The next, you'll see the next slide, it's the ulna. So that's one of the names of the bones in the lower part of your arm, or like your forearm. You have two bones there, the ulna and the radius. But the ulna is when it kind of has this nice little hook. And actually that little hook part is the part that kind of makes your elbow. So that's called the ulna. I always remembered that one because the hook kind of looks like a U. And so I always remembered like U, for ulna. So the next one you can see is your scapula. So this is the bone like on the back of your shoulder. You might call it your shoulder blade. Your shoulder blade is actually one of the features of the scapula. That's called the scapular spine. You don't need to know that for this class. But so you can see the scapula is kind of an irregular shaped bone. It's kind of big and flat in one part that kind of lays against your ribs, and then there's this other protruding part that allows for some of the connections of like your clavicle in the front. They kind of come together on the side, and then your humerus kind of connecting up into the scapula. So that's like just on your back right there on the side. The next bone, the femur, so that's it's the largest bone of the body. That is that large bone in your thigh region. So obviously you have a left and a right. So that's the best bone to have if you want to determine someone's height. That's the most accurate. But any of the other bones of the leg or the arms, like we talked about, will work. It's just this one's like the margin of error is less. So let's see what's next. The tibia. So in the bottom part of your leg, you have two bones. One is quite bigger than the other. This one I'm showing you on slide 17 is called the tibia. And to me, it always looked kind of like a giant T. I'm like, oh, T for tibia. That's how I remembered it. The other bone you have in the bottom part of your leg is called the fibula. It's like a really, really skinny bone. It kind of sets like right next to the tibia. But the tibia is a very large bone in the bottom part of your leg. The next bone, the sternum. Most of you might call this like your breastbone, but it's called the sternum. So this one, you will just have one. It's right here. The top part of it, like, a lot of times you can see in someone kind of right here in the middle, there's that little kind of like little divot, that's actually the top of the sternum. And then all of your most of your ribs, let's say, kind of come up and like via cartilage will connect to the sternum in the front. And you can see on the image on the left on the slide, the sternum has kind of like sections to it. And in the lab, you'll learn, like those names. The next bone we have, so going into like the face and stuff, we've got the mandible. So that's like your jaw. This is another bone most students know the name. They're like, oh, mandible, right? So that's your jaw. That's one of the bones that you can use to determine sex in someone, or it's one of the really good bones. Like if you have it, you definitely want to use it. Multiple features, not just like the size or the width, but multiple features of the mandible are super useful in determining if you're looking at a male or a female. The next bone, the occipital. The occipital is a large bone at like the back of your head and kind of under your head a little bit. And you can see in the image on slide 20, the image on the left is kind of showing that perspective. So it's a fairly large bone. It's like the back of your head on the low end and then kind of underneath. And you'll see there's a large hole on this bone, and that is a very important hole. In osteology, like 95% of the time when there's a hole, the word foramen is used in the name, like something foramen, or the foramen something. Foramen means hole. Like a lot of the bones, names of bones or features have like a Latin origin or like a Greek origin, And so this is called the foramen magnum. It basically means big hole or large hole, and it is very large. So this is where your spinal cord, from like, connecting your brain and then kind of going into, your spine, there has to be a part where they connect to each other. So there has to be kind of an opening at the bottom of your head for that to occur. And so that's where that large, hole is. So in a biped like us, or other bipeds, that hole is on the bottom of the head, right? Because our body is underneath our head. But in a quadruped, so an animal on all fours, that hole is going to be kind of towards the back of the head because their body's kind of behind their head. So you could have just the skull and be able to determine it. Let's say if you're looking at like a biped versus a quadruped, you could even have just the occipital or even just the right fragment of the occipital, and you'd be able to tell that. So very useful in determining like, locomotion type. The next bone, and you can kind of see this really cool animation on the slide 21, is the sphenoid. This is a very odd shaped bone. It's kind of in the middle of your skull, kind of behind your face, under your brain a little bit, and it kind of looks like a giant butterfly. That's the sphenoid. So you can see how complicated and intricate this bone is. And for this bone and any other bone in the body, every single little line, nook, cranny, crevice, hole, they all have names. In the introductory lab that accompanies this course, you will learn like some of those, but if you were to take an osteology like upper division, you would start to really go into all of those names. It's not super difficult, it's just, there's a lot. The next bone is the temporal bone. So this is the bone that's on the side of your head, kind of surrounding your ear and kind of on top of your ear. So that's the bone on the side of the head, the temporal bone. And you'll see part of it kind of starts to extend into your face a little bit. It's like the zygomatic arch right here. So you can also see in the image on the left, there's kind of a hole that's actually like your ear hole, like your ear canal. So the temporal bone is right there. Let's see. Oh, another bone, slide 23, the zygomatic bone. So I just kind of mentioned that zygomatic arch. So the zygomatic bone is the bone right here in the upper part of your face. It kind of makes up the bottom part of your eye orbit and then makes up like this part of your cheekbone right here, the zygomatic. This is the bone I actually focus the majority of my research on. It has been for the last like decade. So I'm really interested in like the upper part of the face a lot. The next few slides kind of go over some pathologies. So like I mentioned, in terms of diseases, not every disease you might have will affect the bone, but many affect the bone directly, and a lot of them affect the bone indirectly. So you can see here, I think I have like 4 or 5. One is, now I'm trying to think, I feel like I mentioned a couple of these before when we were talking about like human variation. It's fine, I'll just do a quick review. But first one, osteoarthritis or degenerative joint disease, or DJD, any of those is fine. This is one we're probably all very familiar with. So this is characterized by like bony overgrowth, fusion of certain bones together, what we call lipping. That's like the overgrowth is the lipping. You can see the image where it shows kind of what a healthy knee region looks like with some bone and some cartilage, and over time that cartilage is diminishing. There's going to be like bone to bone, which is already painful, plus if there's any kind of fusion, so it can really drastically decrease mobility. It can be very painful if those bones start connecting with each other. So in a severe case, it can be very debilitating and very painful. The next one is called cribra orbitalia. So you'll see this is something that only affects the upper part of like the eye orbits. And it is when there is a severe like B12 deficiency, vitamin B12. This individual in their lifetime would not be able to feel that, because you've got like muscle and fat and and then your eye, but you wouldn't be able to feel that on like your eyeball or something. You wouldn't know. Only the person maybe, if they were even looking, like in an autopsy, might see it. Or definitely if we found like remains, out in like the desert from a long time ago, and it's just bones that are left, then maybe if they had that, you'd be able to tell. But it's very specific to that particular deficiency. The next one, which is one we have talked about before, was osteomalacia or rickets. So like I mentioned before, that's when there's that severe vitamin D deficient. It had to be very severe. And then the bones that are supposed to, go from cartilage to bone in a very particular shape don't necessarily get to make that perfect shape. And so they end up oftentimes with either the tibia or the femur, the bone is kind of curved. And so that can cause gait problems or painful, pain in that individual. The next one is called osteomyelitis, which is very interesting. So imagine a scenario where, let's say, you're out and about riding a bike and you've fallen down some stairs or something. So you have a severe injury. Let's say you've broken your leg and the bone is like protruding from the skin. So it's like a compound fracture. So now the outside world has been exposed to the inside of your body. And even best case scenario, let's say you call an ambulance or your friend does, you get to the ER, they're cleaning it and giving you antibiotics right away. There's still always the chance that there could be an infection, of course. And imagine a time in the past, they didn't even know what germs were until like the last 100 years. So, but your bone or your body's very amazing that right away when something like that happens, it's going to start trying to heal itself, like quick, make a bunch of bone. So it's trying to make a bunch of bone. It's going to start laying down new bone to heal that bone that's been broken. And which is why if you've ever broken a bone and you've gone in to get like x-rays, you'll see that at first it kind of looks lumpy, and then over time as it's healing kind of smooths itself out, because that's what it does. The body starts laying down a bunch of new bone, and then it'll kind of smooth itself. But the first instinct is to like heal itself and make new bone and repair itself. And so imagine a case where there is infection now trapped in the bone, but the body's already created new bone to heal itself. Now there's an infection trapped. The body will then create, and that's what you'll see in this image, these holes. The holes are not the injury. The holes are what the body creates long after the injury. They're called cloaca. And it's basically a hole so the bone can drain the infection out of itself. So like the pus and whatnot, drains it out of itself. Unfortunately, then it goes into the rest of the body. And so that's where you can end up with, like a blood infection or sepsis. So it can be fatal. So this would have been something we definitely would have seen way more in the past, like for the reasons I just kind of stated. The last slide is showing tuberculosis. And you'll see very interesting. Tuberculosis is a disease that affects the lungs, right? And for some people, it only affects the lungs and then they don't survive after that. For some, it affects the lungs and the person is living with it, and it starts to then affect the bones near the lung. So like the ribs, the spine. And in a severe case, you'll see the image on the right, which is like the most insanely severe case. This was someone who was alive. This happened to, that the infection got into their vertebrae and was so bad you could see it actually caused the breakdown of at least like 4 or 5 different vertebrae. But there's a slight healing to this. So this person lived. I can't even imagine what this would have looked like, or how this person would have functioned. But it's very interesting to see how severe sometimes it can affect the bone, or not at all. It just depends on the individual. Okay, so kind of wrapping that one up, that's really it. Just kind of learn some of those names of the bones. On the exam, this might be something I ask about, like the femur is a bone in, the arm, true, false. Be like, oh, that's false. So don't stress too much about identification necessarily. That would be something we do more, in the the lab component, if you decide to take that. So I will see you guys on the next one.